Like many in the AAPI community, John Deep, the son of Vietnamese parents, has a story to tell. At the start of the COVID-19 pandemic, he was too afraid to leave his apartment.
Every time without fail, someone would come up to me and start yelling at me, cursing at me, and in a way, like personally blaming me for the pandemic. And the worst was when a car drove by and tried to throw something at me. They missed, but they like purposely slowed down, and so that was a lot.
Deep says he needed to talk about it. He soon realized he wasn't the only one.
As I did, I realized a lot of my family members also went through something like that. But verbalizing it and talking about it and talking about the different strategies that people were using and how they were coping with it really helped to sort of remove the sense of powerlessness that we had and the taboo around talking about those sorts of things.
The center where Deep now works has seen an increase in the need for self-defense workshops from the AAPI community. This increase necessitated the need for a fully fledged program to be developed that includes self-defense training.
That involves knowing the safety protocols that the MTA already has in place for you. That involves understanding how to de-escalate situations if you find yourself in a situation, how to advocate for others, and then again, it involves physical skills. How do I, if someone does try to push me, how can I best keep my balance? If there is a physical altercation, how do I defend myself?
I've found recently that sometimes the best way to help yourself is to help others. There's a lot of the times I think we don't know what to do or what to say, but by simply starting conversations with people, you can find that other people are feeling the same things you are. And just getting it out in an open space and being able to put words to your feelings is so important. And by helping other people, you may realize that you're actually helping yourself too.
At the start of the COVID-19 pandemic, New York City saw a sharp increase in harassment and violence against Asian people and communities. They were wrongfully accused of being carriers of the virus. Back in 2020, the city's Commission on Human Rights reported a 7-fold increase in anti-Asian incidents. And as the world commemorates International Mental Health Day 2 years on, some say this has taken a toll on the mental health on many of those in the city's Asian communities.
To talk about mental health needs, it feels a little, it's very at the proximal end, right? You assault somebody and then you give them a Band-Aid, to somebody who's already bleeding. There definitely needs to be resources available. But I think we really, the right question to ask is actually not just that, it's about why in the first place is it happening.
According to a report by the organization Stop AAPI Hate, from March 2020 to December 2021, more than 10,000 incidents of hate were reported nationwide. 6 out of 10 incidents reported by adults aged 60 and up involved verbal harassment or shunning. 1 in 4 cases against adults 60 and older involved physical assault. And while the world observes Mental Health Day, for many in the AAPI community, getting the necessary help they need isn't that easy. Some don't want others to know they've been harassed or assaulted and fear of being stigmatized by their neighbors. Jody, CGTN, New York.